Afternoon. Honorable Chair, distinguished government representatives, dear fellow activists and advocates, thank you for giving me the opportunity to deliver a statement on behalf of the civil society organizations present here today. I am speaking on behalf of the civil society organizations and 24 Asia Pacific countries convened for the CSO Forum, charting the way forward, progress, gaps, and actions. In advance of this week's midterm review of the ministerial declaration from the 6th APPC and the ICPD Program of Action in Asia Pacific, a number of constituencies were represented at the forum, including, but not limited to, women and girls, adolescent and young people, lesbian, gay, bisexual, transgender, queer, and intersex people, or the LGBTQI people, migrants, aging population, people living with and affected by HIV, people with disabilities, rural people, indigenous and tribal peoples. Mr. Chair, let us start by addressing the progress on ICPD implementation in Asia Pacific, as what has been discussed earlier. There has been significant progress in terms of policies that promote sexual and reproductive health and rights across Asia and the Pacific region. Implementation of SRHR policies still continues to be a challenge, especially in regards to the most marginalized and vulnerable groups, such as women, adolescents, and young people living in urban slums, rural slums, hard-to-reach places, persons with disabilities, migrants, stateless, and ethnic minorities, indigenous and tribal peoples, people who use drugs, sex workers, people living with and affected by HIV, and people of diverse sexual orientation, gender identity expression, and sex characteristics. Meanwhile, Honorable Co-Chair, structural problems in the government, inadequate human, financial, and material resources, centralization of the services, limited capacity of the government agencies to operationalize human rights-based policies, and curative framework of the healthcare system, lack of disaggregated data often lead to implementation gap. Some of the persistent impediments pertain to patriarchal ideology, violence, stigma and discrimination, regressive policy and legislation, and lack of accountability and monitoring mechanisms. In light of this, Honorable Chair, we call on our governments and duty bearers to take the following actions. First, review, repeal, and amend laws and policies that restrict the fulfillment of universal access to SRHR, including services, information, and education. Second, ensure an enabling environment through enactment and enforcement of laws and policies to address SRHR services and issues of marginalized and vulnerable groups. Promote and facilitate the participation of these groups in leadership and decision-making positions. Third, ensure universal access to SRHR information and services using a continuity of quality care through the life cycle approach. This includes access to full range of contraceptives, supplies, and services, maternal health services, including emergency obstetric care, safe abortion, and post-abortion care, HIV, STIs, and reproductive cancers for all. This should address the needs, especially of young and married adolescents and LGBTQI people. Fourth,
Please begin to wrap up.
Yeah. Institutionalize a mechanism of regular capacity building of key stakeholders, including statistical, finance, justice, and other relevant departments on gender-sensitive approach and SRHR. Fifth, Honorable Chair, ensure respect for women, informed decision-making, autonomy, confidentiality, and privacy in the provision of safe abortion services. Sixth, increase national investment and enhance capacities of providers for comprehensive sexuality education to ensure availability and accessibility of rights-based information. Seventh, SRHR policy making and programming must be evidence-based and supported by ethical, gender-sensitive, and country-specific research with strong interlinkages to ICPD and Agenda 2030. Lastly, Honorable Chair, eliminate all forms of multiple, intersecting, sexual, and gender-based discrimination and violence, including intimate partner and non-partner violence and violence perpetuated against LGBTQI+ people. These recommendations, Honorable Chair, will reinforce the basic principle of Agenda 2030, which we all know is to leave no one behind. Thank you.
Thank you. Representative of the Youth Coalition for Sexual and Reproductive Rights.